Hello everybody. In this video we will talk about diabetes. So let's get started. First, what are the different types of diabetes? Diabetes is a group of diseases in which the body doesn't produce enough or any insulin, doesn't properly use the insulin that is produced, or exhibits a combination of both. When any of these things happens, the body is unable to get sugar from the blood into the cells. That leads to high blood sugar levels. The three main types of diabetes are Type 1 diabetes, Type 2 diabetes, Gestational diabetes. What causes diabetes? Type 1 diabetes. Type 1 diabetes is believed to be an autoimmune condition. This means your immune system mistakenly attacks and destroys the beta cells in your pancreas that produce insulin. The damage is permanent. What prompts the attacks isn't clear. There may be both genetic and environmental reasons. Lifestyle factors aren't thought to play a role. Type 2 diabetes. Type 2 diabetes starts as insulin resistance. This means your body can't use insulin efficiently. That stimulates your pancreas to produce more insulin until it can no longer keep up with demand. Insulin production decreases, which leads to high blood sugar. The exact cause of type 2 diabetes is unknown. Contributing factors may include genetics, lack of exercise, being overweight. There may also be other health factors and environmental reasons. Gestational diabetes. Gestational diabetes is due to insulin-blocking hormones produced during pregnancy. This type of diabetes only occurs during pregnancy. What are the symptoms? General symptoms of diabetes include excessive thirst and hunger, frequent urination, drowsiness or fatigue, dry, itchy skin, blurry vision, slow healing wounds. Type 2 diabetes can cause dark patches in the folds of skin in your armpits and neck. Since type 2 diabetes often takes longer to diagnose, you may feel symptoms at the time of diagnosis, like pain or numbness in your feet. Type 1 diabetes often develops more quickly and can cause symptoms like weight loss or a condition called diabetic ketoacidosis. Diabetic ketoacidosis can occur when you have very high blood sugars, but little or no insulin in your body. Symptoms of both types of diabetes can appear at any age, but generally type 1 occurs in children and young adults. Type 2 occurs in people over the age of 45. But younger people are increasingly being diagnosed with type 2 diabetes due to sedentary lifestyles and an increase in weight. How common is diabetes? About 30.3 million people in the United States have diabetes. About 5 to 10% have type 1 diabetes, while 90 to 95% have type 2 diabetes. The latest figures show that 1.5 million adults were newly diagnosed in 2015. Another 84.1 million are thought to have prediabetes. But most people with prediabetes don't know they have the condition. Prediabetes occurs when your blood glucose is higher than it should be, but not high enough to be diabetes. You're more likely to develop diabetes if you have a family history of the disease. Other risk factors for type 2 diabetes include having a sedentary lifestyle, being overweight, having had gestational diabetes or prediabetes. What are the potential complications? Complications of diabetes generally develop over time. Having poorly controlled blood sugar levels increases the risk of serious complications that can become life-threatening. Chronic complications include vessel disease, leading to heart attack or stroke, eye problems, called retinopathy, infection or skin conditions, nerve damage, or neuropathy, kidney damage, or nephropathy, amputations due to neuropathy or vessel disease. Type 2 diabetes may increase the risk of developing Alzheimer's disease, especially if your blood sugar is not well controlled. High blood sugar levels during pregnancy can harm mother and child, increasing the risk of high blood pressure, preeclampsia, miscarriage or stillbirth, birth defects. How are different types of diabetes treated? No matter what type of diabetes you have, you'll need to work closely with your doctor to keep it under control. The main goal is to keep blood glucose levels within your target range. Your doctor will let you know what your target range should be. Targets vary with the type of diabetes, age, and presence of complications. If you have gestational diabetes, your blood sugar targets will be lower than people with other types of diabetes. Physical activity is an important part of diabetes management. Ask your doctor how many minutes per week you should devote to aerobic exercise. Diet is also crucial to good control. You'll also need to monitor your blood pressure and cholesterol. Treating type 1. All people with type 1 diabetes must take insulin to live because damage to the pancreas is permanent. There are different types of insulin available with different times of onset, peak, and duration. Insulin is injected just under the skin. Your doctor will show you how to properly inject and rotate injection sites. You can also use an insulin pump, which is a device worn outside your body that can be programmed to release a specific dose. There are now continuous blood glucose monitors as well that check your sugar 24 hours a day. Treating type 2. Type 2 diabetes is managed with diet and exercise, and can also be treated with a variety of medications to help control blood sugar. The first-line medication is usually methylamine, Glimsa, glucophage, Fortamet, Riamet. This drug helps your body use insulin more effectively. Prevention. There's no known prevention for type 1 diabetes. You can lower your risk of type 2 diabetes if you control your weight and manage your diet, exercise regularly, avoid smoking, high triglycerides, and low HDL cholesterol levels. If you had gestational diabetes or have prediabetes, these habits can delay or prevent the onset of type 2 diabetes. The bottom line: there's no cure for type 1 diabetes. It requires lifelong disease management. But with consistent monitoring and adherence to treatment, you may be able to avoid more serious complications of the disease. If you work closely with your doctor and make good lifestyle choices, type 2 diabetes can often be successfully managed. If you have gestational diabetes, chances are it will resolve after your baby is born, though you do have a higher risk of developing type 2 diabetes later in life. That's all for this video. If you find it useful and you liked it, please click on the like button below the video, and subscribe in your channel, Be Your Doctor, and please don't forget to activate the bell to get all our new videos in your notifications. Have a nice day.